Good morning, and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning, and welcome to this week's Monday Morning Minute. I'm Fitz. We're so excited to have you with us this morning. Today, what we're going to do is we're going to have a little bit of an overview, but we're going to talk about our O-ball abutment implants and how to place them. We're going to go step by step. Here I have our laminated procedural guide that a lot of our doctors keep chairside. It's very helpful. It's step 1 through 9 on how to place a crown with a mini implant. Very simple, very straightforward. So what I'm going to do is I'm going to have this next to me. A lot of the doctors that we work with keep this chairside at the very beginning. Then they get very used to doing this procedure, so they may not need it. But at first, it's very, very helpful. So what do I have with me on the table? Today I have our 7000 Shatkin F.I.R.S.T motor from Aseptico that was all pre-programmed with Dr. Shatkin's settings in it. I have our advanced Shatkin F.I.R.S.T surgical kit, which I'm going to use. And I have a mandible and a demo implant. This is a 2.0 by 11 implant that I'm going to use in the anterior mandible in the lower jaw. So this is the surgical kit. When I open up the surgical kit, what I'm going to first do is I'm going to lift up the upper deck of the surgical kit. And what you'll see here is you'll see a silver, gold, and a blue pilot drill guide. Some dentists refer to it as keys, but we call them pilot drill guides. What does it do? It's going to guide the pilot drill into the correct position. It's going to fit through the sleeve of our surgical guide stent. Okay, so I'm going to take out the silver. The silver is for the 1.2, and if you wanted to make sure, our 1.2 millimeter drill we call the SPDL, single patient drill long. Now, the single patient drill long is exactly what it says it is. We use it on one patient only. When I watch Dr. Shatkin do these cases, he usually will drill 6 holes and replace the drill. If he's doing an upper roundhouse case, for example, he may do 12 pilot holes. He'll use one drill for 6 and another drill for 6. So, and please don't try to autoclave this drill, because the last thing we want to do in this procedure is cause any harm to the bone. We don't want to burnish the bone. So be sure to throw it out when you're completed with the case. So I have my 20-to-1 Mont Blanc handpiece here, and I'm just going to take, I don't have to push the button on the way in, only on the way out. So I'm going to take this pilot drill and I'm going to lock it in. And you'll know when it's locked in. You can feel it. I'm going to grab the pilot drill guide. This is our 1.2. If you'd like to check it before you put it in the patient's mouth, just to make sure, that looks good to me, perfecto. So I'm going to take the pilot drill guide. Usually you would have your assistant hold the drill guide for you as you drill. So I'm on number 1 on the motor, and number 1 is the pilot drill. So I have the foot pedal to my right below me. I'm going to start spinning the drill, and I'm going to make a pilot hole. Perfect. I just drilled the pilot hole. So now, if I was in the office, I would take this and dispose of it, but for demonstration purposes, I'm going to put it back into the surgical kit. So now I have a pilot hole, and what I'm going to do now is I'm going to get our demo implant. I'm going to open this up. And the implants all come with an O-ring housing. If you're doing a denture case, it's always good to have that available. But if you're doing a crown and bridge, which we are this morning, it's a good idea, if you're not going to use that in this case, hold on to these O-ring housings, because you will need them in the future, I promise you. So the implant comes in this plastic cylinder. It's all sterile. I'm not wearing gloves, but I know that you'd have gloves on. I'm going to grab now the contra-angle driver. There's something important I want to explain about our surgical kit. The pilot drills that are disposable are in the top left corner, and it'll say SPDL for the single patient drill long. It's 1.2 millimeters in diameter by 15 millimeters in length. Below that is the SPD, single patient drill, 1.2 millimeters in diameter by 11 millimeters in length. And then we have a drill extender. The drill extender is important if I have 2 close adjacent teeth and I need a little bit more height to get the pilot drill all the way in. And then in this row, these are all autoclavable drills. We start at 1.5, we go to 2.0, 2.5, 3.2, 3.6, and 4.2. All autoclavable. This is the important part. There's 3 squares. The top square are for the O-ball abutment implants. The middle row are for our mono implants. We have a contra-angle, a short driver, and a long driver. The most important thing to remember is that when we're placing MDL and Milos, we use a square ratchet wrench, like the one I have right here. When we're doing the mono implant, I'm going to use the ratchet wrench that's in the bottom with the keys, with the pilot drill guides. And this is a hex driver. So mono wrench in the bottom with the pilot drill guides, and the square wrench that we use for our O-ball abutments, top deck of the surgical kit. Now we have a few more items here. We have spares that you can put anything in here if you'd like. If you need an extra contra angle or what have you, you can put in the spare section. We have a wing wrench that we use for doctors who wanted to screw the implant in like this. They could use that, or they can use our manual wrench, which is about the size of a dime, and it can fit our drivers right into it, and I can screw the implant in like this. Okay? So now let's carry on with our implant placement. I'll put this right back here, and we're good to go. So now we'd like to place the MDL 2011 Shatkin F.I.R.S.T mini dental implant. What I'm going to do now is I'm going to grab the contra-angle driver from our advanced surgical kit. I'm going to put the contra-angle in, and then I'm going to pick up the implant up out of its sterile container. Now, a lot of you may not know this, and I don't know how important it is, but I'm going to tell you anyway. The MDL stands for mini drive lock, and what it does, it locks on to the contra-angle driver, and I'll spin this. My hands never need to touch the implant. And when it's on the contra-angle, now this contra-angle driver, depending on how many cases you're doing, it's going to wear out on you, like a screw would strip. It's very similar. The internal square in this driver is going to wear out over time. So, but I know it's on there. I mean, I can try to shake it off. It's not going anywhere. And the beauty is I can bring it right over to the mouth, and I can place the implant. Something very important, I'm out of the pilot drill mode now, and I'm going to go into preset number 2, which is start implant torque test. If I can get at least 30 Newton centimeters of torque, I can load the implant immediately if I so choose, or we can wait. We can wait 6-8 weeks, we can let it heal up, and then we can come back with the final restoration. So I'm going to start drilling the implant right now. I'm going to hit the foot pedal below me, and the implant I can feel is going into the mandibular bone, which is great. And I'm going to get to a certain point where I feel the hand, I'll either hear it beep, I'm at 30 Newton centimeters, or I may feel the handpiece kick back in my hand a little bit. In either situation, that's the point where we'll take the surgical guide stent and we'll remove it. So I'm going to remove the guide stent, and I'm going to set the motor to preset number 3, which is the final implant placement. And I will drive the implant the rest of the way into bone. So I'll lock the contra-angle back on. Now I'm drilling it. And when the contra-angle driver touches the soft tissue, I am in. And you just heard the motor hit at 60 newtons. So that to me is very good placement. I have the square in the ball above tissue, and I'm through placing the mini dental implant. If I was doing a lower denture case, I would do that 3 more times. But for single teeth, it works out really nice. Now I'll just either put a temporary on this implant, or I can put the final restoration, depending on, that's the choice of the doctor. So I'd like to thank you very much for learning how to use our kit, our motor, and our surgical kit. Keep in mind, having the step-by-step procedural guide is very advantageous to new users to our system. And that leads me to the next topic before we sign off on this Monday Morning Minute. We would like to thank Dr. Javed for the very kind compliments he gave our company here at Shatkin F.I.R.S.T. I know I myself, Lenny, and our entire team across the street really, really value you as a customer. Customer service comes number one at Shatkin F.I.R.S.T, and we're very concerned about making you the very best mini implant dentist that we can make you. Dr. Shatkin is always there to guide you and help you in any situation. And what we think will also be a great value of education, the International Academy of Mini Dental Implants Facebook page. Now, there is a link below that's going to help you to get signed up for the Facebook page. And we have a ton of dentists, brand new dentists to us, who are so interested in learning this procedure. And by you placing your cases on the Facebook page and talking about how the procedure went, sometimes things don't go exactly how planned, but everybody learns. My good buddy Ronald Petrowski, one of our mini dental implant centers out in New Jersey, always tells me that he is such an advocate for people posting cases because he said it is very, very valuable in the educational end of what we're doing. And you could find out so much information. So please join the International Academy of Mini Dental Implants Facebook page and share your cases. So thank you so much for tuning in this morning. And keep in mind that next week at our Monday Morning Minute, we're going to touch on our mono dental implant placement. And remember, any questions, send them our way at Shatkin F.I.R.S.T. And we hope you have a wonderful week placing mini and mono dental implants. And don't forget about our first course of 2024. It's an introductory course on February 2nd and 3rd. And the great news about this course, we're offering a 25% discount on tuition, and we're also going to give you your first implant for free. So come see us in February. We're looking forward to it.